All right, let's pause it and go on to. Okay, here's some figures out of Europe.
The leading cause of death in the European Union is not listening to politicians. It's actually preventable medical injuries in hospitals. And when you compare that with the figures for correct drug prescribing deaths, this is where you're taking the drug as directed and it kills you, again, you come to the same horrifying, in my view, conclusion that doctors and Western allopathic healthcare has become the leading cause of death in most industrialized nations.
One of the biggest.
Did you hear that? That this leading cause of death, the biggest leading cause of death is prescriptions and doctors. Now this guy, Ty Boland, what's his name?
Prescribing deaths. This is where you're taking the drug as directed and it kills you. Again, you come to the same horrifying, in my view, conclusion that doctors and Western allopathic healthcare has become the leading cause of death in most industrialized nations.
One of the biggest dangers that children face.
I think this is Ty Boland or something. Anyhow, he's one that did the shot things. 60s experts in the areas of shots. Here's what he says about this.
Today are these vaccines, especially the mandatory vaccines. So it's the popular mantra that vaccines are safe and effective, right? They're safe and effective. They're safe and effective. It's been said enough times to where everyone knows they're safe and effective. But the reality is, as we saw in the Truth About Vaccines docuseries, and we interviewed, I can't even remember how, almost 60 vaccine experts in that docuseries. They've not been proven to be safe.
I was brainwashed that this is a doctor, he has a medical degree, he is more superior than you. Go to him and he will help you with your child. And that's the mindset out there. You know, I see elderly people having these flu vaccines and some of them are dying. They're getting the flu and they're dying. So yeah, it's killing the elderly, it's killing our children, it's horrific. It's the biggest medical lie ever told.
Biggest medical lie ever told. Vaccines, especially the ones that are prescribed, the ones that are forced upon us, flu and otherwise. Infant vaccines.
Almost every vaccine contains ingredients that we know cause neurological damage and alter DNA.
Causes neurological damage and alters DNA.
Dialysis. I am not going to sign up and take a number to get a terminal illness. I'm going to get on it now. And now's the time.
Running medicine the way we have been for the past century clearly just doesn't work anymore. But technology is moving forward all the time. And some people are predicting radical change is on the way.
What I believe is happening now is we're seeing the initiation of health creation, where it's a completely different conversation. You know, disease management is over here, health creation is over here, and they're very separate.
With any system, wherever we are in history, we have more and more knowledge. So there's no doubt that we have more knowledge about managing our health. One of the fascinating things about the last decade or so research is that rather than seeing the latest research, for example, in pharmacogenomics pointing in the direction where we would soon all be taking, you know, blue and red colored tailored drugs, we're actually looking at a shift in which we move to consuming healthier and healthier diets, in which we can actually individualize those diets for the needs of that particular individual. And that would be based on a combination of that individual's own genes as well as the environment, their past history. The difficulty we have is the underlying infrastructure and political systems that control how healthcare is delivered to the public.
Now that's an important statement that was just stated here. The problem is the political structure and the power structure that is fighting this. They want to make money off our illnesses and they want to control us through pharmaceutical and through false information and advertising. And they want to actually control our health and make money by doing so. They really don't want us out of their pockets. They want to keep us in their pocket and make money off of us as we live. So sad scenario, but true.
Whether it comes from innovation within inside the system, whether it comes from the entrepreneurial minds of the functional medicine community, this is happening. There's going to be a new era in health creation, and I don't know who's going to end up delivering healthcare in 20 years. Maybe it's going to be Amazon or Facebook or whoever. But I can tell you that by the fact that the medical system is not really catching up to this, I think it's going to look very different than it looks now.
I think what's beginning to happen now is there is a genuine bottom-up revolution going on. There are more and more medical doctors who are becoming very frustrated with the situation they've been put into, who are retraining in disciplines such as functional medicine that apply a strongly analytical and scientific lens to the system of healthcare and primary healthcare. And they're taking that into their own hands to deliver a much better system of healthcare that is clearly working for people.
But look, we should be able to, I mean, it's just a biological process. We're biological, we should just figure out what it is. And once that happens, then we can choose to live however long.
I think that 150 years is attainable. And actually there are cases where it appears in China they've documented individuals living to be over 200 years. I believe that's possible. And why I do is because everyone that's living on this planet has these stem cells within them that are actually responsible for repairing tissue when you have damaged liver, skin tissue. These stem cells, very small population, maybe 1 in every 1,000 cells is a stem cell. It'll regenerate that tissue.
Yeah, I hope to live quite longer than 120, maybe double that, or 50%. That hope would be absolutely delusional unless we're relying on the advance of technology, which of course increases at an exponential rate. So in a matter of 10, 20 years, we could have advancements which are really unheard of now, or not even considered.
Well, if you could just tell me what your father's story is, because it's certainly a fascinating story.
Well, he was pretty old. He was 92, and he wasn't doing too well, and I took him to the Mayo Clinic in Arizona, and they said, "You better leave him here, he's going to be dead." And I'm like, really? So they kept him there 10 days, stabilized him, identified a number of problems, just wearing out, the kidneys, he had some congestive heart stuff and lung stuff, and various other things. His hip was, hurting, he was not ambulatory, and he was in a lot of pain and pretty listless and sick. So I put him on a plane and got him down here. And, we shot him in the hip. And they thought they had to do 2 hips. So they had enough for 2 hips, but it was so much, but they put double the amount in 1 hip. And then, of course, they just dropped some into his bloodstream, like 100 million cells or something like that. So, but every ailment that this man had kind of righted itself, and pretty quickly, too.
Mel's father was treated at Neil Reardon's clinic in Panama with stem cells harvested from umbilical cords after cesarean sections.
What I do myself, and what I think is going to be ultimately the answer for a lot of age-related decline and age-related chronic diseases, is taking young healthy stem cells, for example, from umbilical cord, and using those to supplement what you have. Because not only do they do the job of the stem cells that you used to have, but they also stimulate what you have left to behave younger.
I think it's a miracle, and I think we'll see bigger and better things from it. We don't even know. I think Neil's he's like some kind of test pilot. He's like some kind of, and I had another buddy come down with some serious illness, and he's like a lab rat, this guy. So I mean, they're finding stuff out that's pretty amazing, and I don't want to talk too much, but I've seen some wild things. I've seen, people who couldn't conceive. I've seen people with autism get a semblance of having that reversed, and people that didn't talk all of a sudden begin to converse, the autism thing. People in wheelchairs who were able to get up and walk. I mean, this is spinal cord injuries and stuff. So I mean, I don't know. They, I don't think the FDA digs it because it fixes everything and it maybe robs them of, being able to. Pharmaceutical companies. I don't know. It's the usual sort of conspiracy theory, but I go for it. Actually, I think
Oh, pretty incredible. I'm gonna edit this. I think there's a lot more in the stem cell search area that is not even close to where we need to be. We need to be totally open on this and using it. Because they're using this from umbilical cords and they're getting this placenta. Holy cow, why aren't we using it? They shoot people up with this. I'm sure it costs a good amount of money, but to have such incredible results in time is just amazing.